deadly diagnoses hidden behind mild symptoms. Sepsis case. A patient's wife called me because her husband had a temperature of 37°C with no other symptoms. I explained that this was normal, but she insisted something was wrong despite the lack of additional symptoms. I advised her to bring him to the hospital. 4 hours later, an ER doctor called and said they did everything they could, but the man died of sepsis. When he arrived at the hospital, he looked fine, but his condition rapidly deteriorated. After this case, I once again reinforced my understanding that we truly cannot properly assess someone's condition over the phone. Aggressive bone cancer. I am a dentist, and a new patient came in with what he thought was a mild toothache. He hadn't been to the dentist for several years. We took an X-ray, which showed that the jawbone around his teeth looked strange. The same day, he went to a maxillofacial surgeon, who diagnosed him with very aggressive metastatic bone cancer. A few weeks later, the man passed away. Lung cancer. One morning, my father woke up with severe back pain. Although he hadn't complained about anything unusual for days or even weeks, my mom insisted on taking him to the hospital. During the examination, it was discovered that one of his ribs was broken due to a massive tumor on his spine. He also had tumors in his buttocks, pelvis, and upper back. Diagnosis: stage 4 lung cancer. After 5 years and hundreds of treatments, he continues to fight the disease. Leukemia. I'm a nurse, and several years ago, a young man came to us asking for medication to stop excessive sweating. He said he'd had a sore throat for about a week, visited a clinic where they diagnosed pharyngitis and prescribed antibiotics. However, he was sweating profusely and looking pale. After running some blood tests, his white blood cell count was through the roof. Diagnosis: leukemia. We sent him to another hospital for immediate treatment, but unfortunately, he died just hours after arriving. Initially, I couldn't believe it was such a tragic case. The same thing happened to my father. He had a sore throat and felt weak, so he went to the hospital. Eventually, he ended up in the ICU and never returned home. Acute leukemia can progress extremely fast and unexpectedly. Aortic dissection. A patient came in with minor cardiovascular symptoms and mild pain in the upper part of his back. The doctor debated whether it was necessary to perform a CT scan to rule out anything serious. Ultimately, she decided to proceed with the scan. It turned out the patient had extensive aortic dissection, so he was immediately taken to surgery. Uterine tumor discovery. I'm still studying medicine, and I wasn't present during the initial consultation but participated in follow-up care. The patient was a healthy-looking woman in her early 50s who experienced prolonged nosebleeds after a long walk. Since the bleeding wouldn't stop, she came to the hospital to have the wound cauterized. According to protocol, she underwent a CT scan, which revealed a uterine tumor larger than 20 cm. She was referred to a major university hospital, where a specialized oncological surgeon successfully removed the tumor without damaging the kidney. Despite the ordeal, the most impressive part is that the tumor was fully removed, leaving only a 15 cm scar on her abdomen. While I don't think the CT was ordered solely because of the nosebleed, I suspect further analysis of her blood and coagulation tests revealed something requiring additional investigation. Esophageal cancer. In our department, a man whose wife constantly complained about his bad breath came in for a biopsy. Upon examination, the tissue sample confirmed esophageal cancer. Unexpected death in waiting room. I worked as head of security at a hospital. One day, a couple came in. The man felt unwell and thought he had the flu or a cold. They didn't have a family doctor, so they went to the emergency room. The man took a seat in the waiting area while his wife went to park the car. As I later learned, the man suffered from some kind of gastrointestinal rupture. He sat down, then slumped forward and died within 30 seconds. Security noticed something was wrong, checked on him, and realized he wasn't breathing. They performed CPR until the ER staff arrived, but it was too late. When the wife returned, expecting her husband to still be sitting in the waiting room, the guards informed her that he had passed away, and the doctors were attempting resuscitation. From the wife's perspective, she walked into the hospital with her husband feeling fine, left for 5 minutes, and came back to find him dead. Leiomyosarcoma. My mother frequently visited doctors and hospitals due to extreme fatigue, sudden weight gain, prolonged absence of menstruation, and severe dehydration. Finally, a doctor noticed these issues and ordered a CT scan. It revealed a tumor the size of a grapefruit in her inferior vena cava. Later, she was diagnosed with leiomyosarcoma, stage 4. Doctors gave her only a few weeks to live, but she fought the disease for nearly 5 years. Kidney failure. Not long ago, I read a story about an ER doctor conducting training for young medical students. A disheveled man in an old suit, clearly homeless, approached her complaining of nonspecific malaise while muttering something about quantum mechanics. His mental state seemed off, and she initially thought he might be seeking drugs. However, she decided to conduct basic diagnostics to demonstrate the process to future specialists. It turned out the man had severe kidney failure. Once placed on dialysis, he quickly regained his composure and became fully coherent. It was later revealed that the man was a real professor and expert in quantum mechanics traveling to a conference when his kidneys failed, causing him to lose consciousness and disembark at a random train station in a confused state. For months, he wandered the streets but somehow survived. Autoimmune disease. For 6 months, I was told I had a severe cold and anemia, so I was prescribed iron tablets. It turned out I had an autoimmune disorder leading to kidney failure. Eventually, I ended up on dialysis and received a transplant. Cervical bleeding post-menopause. I'll tell you about my relative. In 2019, I underwent a hysteroscopy, which went smoothly, and recovery was easy. One day, this relative suddenly called me asking for the name of the gynecologist who performed my procedure. She mentioned having unexpected menstrual bleeding, thinking it was related to menopause. Her reaction proved life-saving because what she assumed were menopausal irregularities turned out to be cervical cancer caught at an extremely early stage. She underwent a hysterectomy and radiation therapy. 3 years later, she remains cancer-free. Postmenopausal bleeding should always raise suspicion. Broccoli aversion. My father consulted a doctor because he suddenly developed an aversion to broccoli. Otherwise, he was healthy, around 60 years old, and led an active lifestyle. He was diagnosed with leukemia. Imagine how surprised the doctor must have been hearing such a complaint from a patient. Bullet wound. Years ago, while working in the ER, a man walked in holding his forehead and asking for a doctor. To my surprise, when I asked him what happened, he lifted his hand to reveal a bullet wound. He was rushed into surgery, and later I found out the bullet hadn't reached his brain but instead lodged itself in his skull. Childhood kidney cancer. As a child, I constantly complained of stomach pain. My mom took me to various doctors, who dismissed my complaints as attempts to skip school. For an entire school year, nothing more than blood tests were conducted. But when I began urinating blood, she rushed me to a pediatric hospital, where I was diagnosed with stage 4 kidney cancer that had already spread to both lungs, lymph nodes, and around my heart. Rabies vaccination. I was bitten by a bat and decided I needed a rabies vaccination immediately. My wife argued it would be expensive and suggested waiting to see if I got sick. I almost listened to her until I researched the first symptoms of rabies online. I learned that once symptoms appear, death is guaranteed, and anyone bitten must receive the vaccine as soon as possible. Neurological diagnosis. I'm a neurologist, and a seemingly healthy patient came in complaining of numbness in her left hand for several months. My first thought was carpal tunnel syndrome, but upon closer inspection, I wasn't convinced. I ordered a CT scan of her brain, which revealed malignant metastatic lesions. The patient, along with her family, had been discussing expensive designer handbags when I delivered the news. In an instant, she transformed from a healthy individual into someone given only months to live. Abdominal aortic aneurysm. While working in trauma care, an elderly man came in with his son-in-law. His symptoms included constipation, mild abdominal pain, and slight bloating. They simply requested laxatives to relieve the constipation. During the physical exam, I detected a firm mass in the center of his abdomen, which was unusual. Medical school taught us to check for abdominal aortic aneurysms by forming a triangular shape with our fingers around the navel. When I did this, I felt strong pulsations and panicked. I immediately ordered a CT scan, which confirmed an aortic aneurysm with dangerously thin walls. The patient was urgently transferred to surgery. Surgeons warned that even sneezing could cause the aneurysm to burst, resulting in rapid blood loss. Surprisingly, after the operation, the man survived and was discharged from the hospital, though I'm unsure of his condition afterward. This experience reminded me how critical thorough examinations are, as his issue could have easily been mistaken for a hernia or fecal impaction. More stories on our channel.